Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today, we shall be looking at the topic ringworm transformation to cancer in obese. This topic is so interesting because ordinarily we look at ringworm as being harmless and if not for the discrimination that people will now be looking at you as lower in immunity or a malnourished person or that you don't really monitor your hygiene, you are very probably dirty and stuff like that. When you see ringworm in people, you tend to want to stigmatize them. Children too have it ordinarily because the immunity of the child is understood. But when adults have them, they start really suspecting their hygiene level. But far from that, we have now discovered that untreated ringworms could also be complicated with staph aureus and other pathogenic organisms that will now expand the wound. But the latest discovery is mind-boggling, and that is what I want to show you, that it could also transform to cancer. So let's sit down and have a listening to what has been discovered by great researchers and giving them merit. Support this production by subscribing and pressing the like button. Always, the quality will continue to improve and you will continue to enjoy the best from me. Yeah, the objective is to create the necessary awareness of the possibility of untreated ringworm transforming to cancer, and that obesity is a risk factor also for ringworm and cancer. The introduction. Ringworm is not a worm that you want to believe because of the name, but it's derived from the circular shape, the edges, you see it appearing like worms. It is a dermatophyte and it's also called tinea. The tinea name now is used in conjunction with the part of the body that is affected to describe the disease. For example, if it affects the head, the capitis is now tinea capitis, the feet, tinea pedis, the body, tinea corporis, tinea cruris when it's the crush. Other terms are often used by the laymen. Lay athletics feet, jog itch, Como bus stop, jungle roads. There are so many local names for it. Ringworms are classified under fungi causing cutaneous mycosis. The mycosis is derived from mycology, which is closely related to subcutaneous mycosis because they all appear on the skin. The entry into the body is usually the skin must be first traumatized or a traumatized condition when occultated with non-porous materials. This increases hydration and temperature of the skin and interferes with the natural barrier function of the superficial layer. Such occasions are brought about by wearing non-porous shoe. When you wear very tight shoe and even wear it for a very long time, the worm and the heat, the hair that you penetrate will not be there. Or where you covering the skin with occlusive bandages. All this creates that humidity and the temperature necessary for this fungi to grow and cause that mycosis. Then you can also talk of being in close proximity with people who have it, or babies, because children between the age of as babies up to 12 years old are usually having it. You can understand the immunity of children is very low. So at that stage, those who are always in contact carrying these babies and could contact it. But with regular hygiene, such may not be a problem. Obesity starts from when your body mass index, BMI, is or above 30 kilogram per meter square, and this has been found by many researchers to constitute one of the risk factors for dermatophytosis, that is, the subcutaneous mycosis or cutaneous mycosis. The risk of dermatophytosis is significantly increased in individuals with elevated waist circumference or high BMI. These are work findings of so many researchers. Some of their names are there. And then you can understand when you see obese people, they have folded skin, just like something occluding that area from fresh air. And the warmth, humidity of that area, the hydration in that area will surely allow this fungi to grow. The dermatophyte will grow and they will now produce these various problems. You have Trichophyton, Mycosporum, all of them causing problem in specific areas of the skin. Yes, let's look at this photo. You can see how ringworms are. In the picture to the left, it's so circular, the worms like all of them. But the difference between these rashes is that the ringworm rashes is very scaly and itchy. When you itch, you'll be peeling out the cells, the exfoliative, the epidermal cells. And that is what is called a jog for areas where it's eating. And this allows it to spread. And the more you itch, the more it spread. And except you take up the necessary hygienic correction. Now we are gradually coming to that cancer part of transforming fungal infection to cancer. This is a case study. You can see the ringworm around the leg of this lady, around the calf to the hedge. And this is a 35-year-old female patient with a 10-year history of a chronic ringworm infestation that had developed a non-healing ulcer in an area of infestation on the right leg. A biopsy done on that right leg revealed well-differentiated squamous cell carcinoma associated with the ringworm infection. So that tells you that when this ringworm infection is untreated, it could harbor in that area and become cancerous. Yes, we call it transformation. That is the fungal infection of the wound transforming to being a cancer. The patient has been suffering from cutaneous ringworm infection of the upper extremities, anterior abdomen, and lower extremities for more than 10 years. However, she had not sought a proper dermatological opinion, receiving only irregular over-the-counter treatment for 6 years. The histological finding proves squamous cell cancer of the marginal ulcer. Other findings from other researches: overweight status or obesity during early adulthood is also associated with a greater risk of pancreatic cancer, and obesity later in life, and a lower overall survival in patients with pancreatic cancer. In a multi-center cohort study in Sweden, obesity was also found to be related to worse pancreatic cancer prognosis. Researcher at the New York University School of Medicine reported in the October 10, 2019 issue of Nature that patients with pancreatic ductal adenocarcinoma, the most common form of pancreatic cancer, have a higher abundance of fungi in their pancreas than healthy individuals. They also showed that the gut and pancreas in cancer patients have distinct fungal composition. By far the most abundant fungus in the pancreas, but not the gut, was Malassezii. This was a surprising finding, as Malassezii is mostly known for causing skin-related conditions such as dandruff, eczema, and dermatitis. So this is more of recent research that I will had to. Another recent finding had the AACR annual meeting 2022, and in an article published this year, researchers showed that in a subset of pancreatic cancer, fungi promoted the secretion of an immune suppressing protein called interleukin 33, potentially enabling these cancers to circumvent the anti-tumor effect of the immune response and progress to more advanced stages. Interestingly, the expression of interleukin 33 was increased by a mutated form of the KRAS protein, thus revealing a tumor-promoting collaboration between these common mutants and the microbiome, that is the fungi resident in pancreatic cancer. So you can see from all these research findings that the fungi plays a major role in the cancers that usually arises from these patients. Laboratory diagnosis. Fungal infection are diagnosed in the laboratory by direct microscopy of the scraping. Culture and sensitivity and serology are done to really confirm the infection. Biopsy is also useful. PCR, and the morphology is usually to differentiate the different types of the dermatophytes, whether it's the Microsporum species, the Trichophytum, or the Epidermophytum. The microconidia are very diagnostic, the micro and also chlamydospore. The yeast cells, Candida albicans, will always come out as budding cells, and that is very diagnostic of Candida albicans. Now that you have heard so much as regards how the transformation can take place, there is that need for us to therefore be careful and not leave ringworms untreated, or probably in our dealings, those who are immunosuppressed or immunocompromised by way of infection or by way of treatment, they should be extra careful to take notes of the treatment for this ringworm, which could complicate matter and make it worse. Continue to subscribe, continue to listen to my video, especially on this channel, Akinola-Anjou.